Hi, I'm Nadine Griskoyak, also known as the Gluten Free RN. Thank you very much for joining us today for the third episode of Gluten Free RN podcast. And today our topic is going to be the urinary system. Everything to do with your kidneys, bladder, elimination of urine, and anything else that entails. So welcome back to Gluten Free RN podcast, and here we go. Hi, welcome to the third episode of Gluten Free RN podcast. This is Nadine Griskoyak, also known as the Gluten Free RN. Today, for the third episode, we are going to discuss urinary issues associated with the ingestion of gluten, gluten intolerance, and or celiac disease. Interestingly enough, most recently, my good friend Wendy Cohan had come from a visit from Missoula, Montana. And we had great discussions about bladder issues because she is the author of a fabulous book entitled The Better Bladder Book, a holistic approach to healing interstitial cystitis and chronic pelvic pain. Again, it's by Wendy Cohan, Cohan. She's a registered nurse, and she and I had actually worked at a hospital up in Portland, Oregon. She worked in ICU, which is the intensive care unit, and I worked in the emergency department pretty much at the same time, but we didn't know each other at that point. We didn't meet until we both figured out that we had a common interest, which was celiac disease and gluten intolerance. So we ended up meeting at a restaurant not far from where we were working at the time, and we had a meeting. And it was very interesting because one of the first things after meeting, she said, "That's really interesting. You're about the 50th person I've met with celiac disease that has red hair and hazel eyes." I thought, I'm not sure what that has to do with it. But now over time, we've kind of determined that people with red hair and hazel eyes are, for some reason, genetically predisposed to have celiac disease, interestingly enough. So I kind of fit into that thing for her, but then also she is very tall, has blonde hair and blue eyes, so also having celiac disease. But she was not able to work in ICU anymore. So what ended her career of working was, come to find out, what's known as interstitial cystitis. And interstitial cystitis can cause chronic pelvic pain and really bladder pain, bladder spasms, any type of pain. It actually feels like a really, really intense urinary tract infection. But when you test the urine, it actually comes back negative for infection. So the interstitial cystitis, and if we think of the cystitis as an inflammatory process that occurs in the lining of the bladder, affecting the tissue, or the skin of the bladder, let's say, it gets inflamed. And so once that tissue or the skin of the bladder gets inflamed, anytime there's anything that is irritating on that tissue, such as urine, it will cause bladder spasms and pain. So you would think, yeah, well, okay, you can probably take pain medication and it'll go away. But the reality is the pain medication tends not to work. And it's very hard to do anything in life if you have that pain. So it's hard to move, it's hard to sleep, it's always there. And anytime you have any chronic pain in your body, then we really need to pay attention to that, because ideally and generally, you should not be aware of any part of your body. You should just pretty much float through space, and your body and your proprioception should tell you where you are, and that, everything should be really good. You should not notice any part of your body. You know how when you wear an irritating pair of shoes or something that is giving you like a blister on your heel, and you're very aware of that part of your body? Well, if you have any type of problem with interstitial cystitis, you'll be very aware of your bladder all of the time. So Wendy and I had lovely conversations, and she said, I don't even consider myself to be an expert on this anymore, mostly because I haven't had symptoms for so long. But she is an expert. She's a very, very knowledgeable expert. And what she found out is that once she was diagnosed with celiac disease or went on a gluten-free diet, and she took several other things out that were actually triggering her interstitial cystitis, she no longer had it. She no longer, after many years, has interstitial cystitis, or IC as it's commonly known. So what are some other issues related to the urinary system that could be caused by ingestion of gluten or gluten intolerance or celiac disease? We know that kidney stones, especially if they're calcium oxalate, can be caused by gluten, ingesting gluten or eating gluten. And interestingly enough, and we'll talk about this in the brain section when we do an episode on the effects of gluten on the brain, but if you have calcium oxalate stones in your kidneys, there's a rare chance, and it's been documented several times, that you could also develop brain stones, calcium oxalate brain stones, or calcium deposits in the cerebellar region of your brain. Now, that's never a good idea because we do have lithotripsy for calcium oxalate or any kidney stones that are affecting the kidneys. Lithotripsy actually breaks up those stones. It's sound waves that break up the stones so that they can be passed through the urethra into the bladder and then out into the toilet, hopefully. So, but you can't do that with brain stones. There is no lithotripsy for the brain stones. So we want to prevent those as much as possible. So kidney stones, repeat urinary tract infections would suggest a damaged immune system. And we want to actually bolster up the immune system so that the infections are not a problem anymore. Interestingly enough, bedwetting. So if you have interstitial cystitis, or if you have any, let's just say any irritation or inflammation in your bladder, it's very difficult to hold on to the urine because that urine will, as we talked about earlier, cause bladder spasm or irritation, and your bladder lining literally goes, okay, get that off me because it's really irritating, and make it go away. So children that are bedwetters frequently have interstitial cystitis or some type of inflammation that prevents them from being able to hold their urine overnight. I really wish I would have known this for my children, especially because, it's not a behavior modification thing or yelling at them or getting angry in the middle of the night when you have to change the sheets for the third time. It's actually a issue with the bladder itself and what they're eating, believe it or not. So we'll talk about bedwetting, and it's not just for children either. There are some adults that are bedwetters. And as we get older, we know that a lot of people that are a little older sometimes have to wear urinary incontinent pads or Depends or some type of thing so that, they're not wetting themselves all the time. And there are medications to treat urinary incontinence, but frequently there are side effects with those, such as dehydration. So, which I see commonly. So ideally, what we're going to do with any of these issues is deal with the underlying cause, which frequently is ingesting gluten or gluten intolerance and or celiac disease, and treat that underlying issue appropriately. Many times that is simply a diet change, such as a gluten-free diet, typically a dairy-free diet. And if people are really sick or they have other issues, there's many other approaches to diet that can be helpful. So everything we consume, every food, every beverage is a chemical, and how that chemical affects our body is sometimes very potent. And it can be a very potent healer or a very potent poison. So, and again, it depends on our genetics. It's called epigenetics. And it's also very important to just be aware of how different foods can affect our bodies in a good way or potentially a not a good way. So we want to take out anything that is going to cause inflammation so that we can either treat or make some of these symptoms go away, or actually so we can prevent worse issues in the future. So there's several issues for men that go along with the kidney stones, potentially bedwetting, urinary incontinence, but also prostatitis, prostate cancer, erectile dysfunction, also known as ED, which I'm sure you've seen commercials on TV for. So those are all issues, again, of inflammation. And ED specifically speaks to what I would refer to as decreased blood flow, or in some cases, hypoxia. So your tissue is not getting enough oxygen, and nothing can work appropriately in that case because our bodies depend on the oxygen, the air that we breathe, with every breath. So we need that oxygen so that our tissues can work appropriately. So chronic pelvic pain, urinary urgency, frequency, in the case of no infection. So if you have urgency and frequency, you probably should get checked. It's a very simple test of a urine dip, as we called them in the emergency department, or you can go to your doctor and have a urinalysis run, essentially the same thing. And then a culture and sensitivity would also be ordered if there isn't an infection. So always try to identify the underlying issue and treat that underlying issue appropriately. What does that mean sometimes? Maybe it is a diet change. Maybe sometimes it is treating an infection with an appropriate antibiotic. And please be aware that antibiotics are not to be taken for every symptom that you have. They should be used very judiciously. And we do call that antibiotic stewardship at this point. The CDC actually has several great references for antibiotic stewardship, which means don't throw antibiotics at every symptom that comes up, because it's inappropriate. What those antibiotics do are not just attack the bacteria that we're trying to treat, but they attack every microbiome that we have in our bodies. So that's not always a good idea. We want to either be very specific with the antibiotic to treat the infection that we actually have, or maybe just treat the infection in a way that does not damage all of our microbiome or wipe it out. Because we'll talk about that at a future episode also, that if your intestines are damaged, then your immune system is damaged. And if your immune system is damaged, it's very difficult for your immune system and your body to protect itself. So frequently, these people with damaged intestines will be at increased risk for developing infections. So again, we want to look for those underlying causes, treat them appropriately. And in many cases, the simple solution is the removal of gluten and dairy and any other pro-inflammatory food or substance that we eat. Some of us, I know I used to eat gluten and dairy and pretty much was on the standard American diet myself every day. But once I found out that a lot of my symptoms and my skin issues and everything were caused by gluten, and I removed the gluten, things that I really thought were just normal for me actually went away. So I had the urgency and frequency with my urination sometimes. You just can't get to the bathroom fast enough. Or you have, it's like, what is that? Why am I not able to hold my urine today? It's affected. Your ability to hold your urine is definitely affected by the fact that you have potentially some inflammation in your bladder lining, especially, again, in the absence of an infection. So, as Wendy points out in her book, and extremely articulately, she says that very rarely do any of these urinary issues come in isolation, that there's other body systems that are affected also. And that just makes sense. A lot of these patients have irritable bowel syndrome, or they have diarrhea, or they have other autoimmune issues that are very consistent with an entire body being affected by, in this case, food. So let me just read a paragraph from A New Approach to Bladder and Pelvic Pain, which is that many patients with IC, interstitial cystitis, or chronic prostatitis have anecdotally reported that bladder pain increases when eating food to which they are sensitive. This has now been confirmed in a large study whose results were reported at the 2009 meeting of the American Urological Association. In a survey, 95% of female IC patients and 77% of male CP patients, again, chronic prostatitis, patients reported that they had food sensitivities. A Swedish study also reported food sensitivity and allergy is the most frequently encountered comorbid, occurring together, condition among IC patients. And a study of more than 2,400 IC patients found an increased association with allergies. Wendy further goes along to say that large numbers of those people with IC or other forms of chronic pelvic pain reported having an additional symptom or other chronic disorders, including irritable bowel syndrome, frequent migraines, and chronic pain around the opening to the vagina. In a recent study involving more than 200 IC patients, 49% reported symptoms that indicated they also had IBS, irritable bowel syndrome, and 59% had symptoms that indicated they had fibromyalgia. In a much larger study, IC patients were 100 times more likely to suffer from more serious inflammatory bowel disorders such as Crohn's disease and ulcerative colitis. There's also clinical evidence supporting an association between IC and some autoimmune disorders such as chronic fatigue syndrome, fibromyalgia, lupus, SLE, and Sjogren's syndrome. So here we have several situations supported by scientific evidence that rarely does IC or interstitial cystitis happen in a bubble, that bubble being your bladder, that it tends to be an entire body system dysfunction or issue that needs to be addressed holistically, which means we're addressing the entire body and really just looking at the fundamental issues that could be causing the symptoms themselves. The symptoms themselves are an indicator that there's something that is not correct or that your body isn't able to compensate. And so we need to really address those issues and make sure that people have good information. Because if you just treat those symptoms and don't actually address the underlying issue, what happens is people tend to accumulate more symptoms. So you take a pill for interstitial cystitis, but then something else falls apart, or do you develop new symptoms? Now, everybody is different. Every patient is their own science experiment, and they present with their own unique history and physical, medical history, and their family history. So everybody really is their own science experiment when we talk about a lot of these issues. Just to review, the urinary system is made up of 2 kidneys. Everybody has them. We call that, if people have pain in their kidneys, it's referred to as flank pain. So if you have kidney stones or any type of kidney infection, we look at the flank area as potentially the area that's going to have pain. So 2 kidneys, one on each side, and they're located in the back of our torso, and 2 ureters. And those are the tubes that will carry the urine from the kidneys to the bladder. The bladder itself, which is the balloon-like structure that holds the urine. Otherwise, we would be dripping urine all the time. And there's a couple sphincters, little valves that hold the urine in the bladder until we say, okay, it's time to pee. And release the urine, and I'm going to go on with my day. And then from the bladder goes the urethra, and that is the tube that goes from the bladder to the outside. And we all have a nice little opening that allows the urine to flow out of our bodies, allowing us to excrete things that do not belong in our bodies and waste products in the form of a liquid. And that liquid, if we're well hydrated and everything, should be relatively lightly yellow in color, and there should be no foam, and it shouldn't be dark. If it's dark or thick or anything, there could be a problem. And so you want to go ahead and make sure that you do get a urinalysis or go see your healthcare provider to address issues that you're concerned about. I do have one friend who has 1 kidney, and she said, well, I was only born with 1 kidney. And I said, really? I said, why do you think that is? And she said, well, I don't know. Why would I only be born with 1 kidney? That could go back to the fact that maybe her mom was celiac, was having a hard time absorbing nutrients, and that is considered to be a congenital anomaly that she only has 1 kidney. And really the question needs to be asked, why does she only have 1 kidney? What happened during fetal development that her body was only able to actually make 1 kidney for her? She's perfectly healthy. Everything's good. She is, in fact, positive for celiac disease and on a gluten-free diet and doing much better now with all of the things that she just considered to be normal. Another interesting thing is that I work with people with all types of symptoms, and I had a gentleman who had a increasing PSA, which is a test for prostate cancer. They keep an eye on that PSA, and as it climbs higher, then they actually are concerned about prostate cancer. And this gentleman had a family history of men in his family developing prostate cancer. So he was tested for celiac disease, and he's gene negative, but he had a lot of symptoms that sort of went along with gluten intolerance, such as gas and bloating, and not able to sleep well, getting up several times a night to go use the bathroom. And so basically he went on a paleo diet and did the whole 30-4, which is essentially a whole food diet for 30 days. And at the end of those 30 days, went back and had his PSA taken again. And it was back within normal limits, which means that he no longer had what would be considered to be a precancerous prostate. And when you have a PSA that is climbing, or the numbers are going up, frequently doctors will want to do a biopsy, and that includes sticking a needle into your prostate. And it was suggested that they were going to take 8 biopsies, which means 8 needles. And there's a chance that those tests are not always accurate, that they could miss the cancer if it's there, and all kinds of other things. So a diet change is a great option if you're looking at potentially having to do any of those tests that are pretty invasive or involve cancer treatments. It's never a bad idea, especially for your immune system and your body in general, if you have to go through a biopsy or any type of treatment, that you optimize your health and make sure that your body and your immune system is as healthy as possible. So in this case, this gentleman very quite quickly turned around his PSA. So he will continue to get it checked and will keep an eye on the PSA. But right now, it's not that a burning issue that needs to be addressed immediately with a biopsy. So just because you have things that are going on with your urinary system, it doesn't mean they can't be addressed. And that is one of the things that Wendy did a fabulous job about in her book, again, the Better Bladder Book, A Holistic Approach to Healing Interstitial Cystitis and Chronic Pelvic Pain. A lot of what she recommends is a gluten-free diet and making sure that your bladder and your kidneys and your urinary system in toto is as healthy as it can be and not inflamed. Because, again, we should not be aware of our bladder on a daily basis. It should not be the organ that we're going, hey, what's going on down there? Because I have to pee again and it's only been 5 minutes. Or where's the bathroom? And always having to be aware of where the bathroom is. Just because we're getting older, it does not mean that our bladder should be giving out or that our body should not be working appropriately. Everything really should continue to work appropriately in the absence of inflammation, in the absence of disease, and all the things that we hope to avoid and stay healthy well into our old age. So you can find Wendy's information at the Better Bladder Book information.com. She is an excellent, excellent resource. And I frequently have heard over the years that a lot of the doctors don't actually think that the bladder or the urinary system is affected by gluten, even the celiac specialist. And the reality is that our body is completely affected by gluten, including the urinary system. There's just no way that you can separate that urinary system out from the rest of our body. So what we do need is more research, more studies actually pointing to the correlation between eating gluten, gluten intolerance, and celiac disease and our urinary system. So if you're in a position to do that, please develop a study and let me know how everything turns out. Because what we do know anecdotally and through seeing multiple patients from all walks of life is that just the removal of the gluten from the diet can positively affect people's health and make things better. So I would like to thank Wendy Cohan, number one, for writing the Better Bladder Book, and also for coming to visit me and having such great conversations, not just about the bladder and the urinary system, about everything that nurses do and how great we are and how really, truly a pleasure it is to see people get better. This is Nadine Griskowiak, Gluten Free RN, saying goodbye for today, but stay tuned for more in the next episode of the Gluten Free RN podcast. Find more information at www.glutenfreern.com. I'm available for speaking events, private consultations, and family consultations. I'm also a professional speaker and have given talks on gluten intolerance and celiac disease all throughout the United States, Canada, and a couple times in Europe. Let's just say I'm an international speaker on gluten intolerance and celiac disease. I'm also the author of Donation, a nurse's memoir of celiac disease from misdiagnosis to food and health activism. Donation is available on my website, again, www.glutenfreern.com, Barnes & Noble, Amazon.com, all of your local independent bookstores are able to order it, and it should be at every library throughout the United States. If it's not, you can request it. Thank you very much for joining us, and we'll see you next time on Gluten Free RN Podcast. Bye for now, and thanks for listening.